Hello, welcome to the course Evaluation and Treatment of Mental Disorders. Similar to previous students, you're probably very excited to enroll in this course and to learn about the various mental disorders that people experience. As your professor, I look forward to facilitating your growth and developing your knowledge and skills about such disorders, the DSM-5, developing an assessment, formulating a diagnostic impression, and developing treatment plans. While most of you have been students of mine in the past, we do have a couple of new students, hence I'll give an introduction of myself. I've been a member of the BSU School of Social Work faculty since 2007. After graduating from the Peter Bent Brigham School of Nursing in Boston, Massachusetts, I was a registered nurse for 30 years, having specialized in critical care medicine for most of my career. During the 1990s, I worked with transgendered males to females, fitting them with breast prostheses. After hearing of their oppression and discrimination, I decided to enter the field of social work. I earned my MSW and PhD from the State University of New York at the University at Albany, in Albany, New York, with a concentration in direct practice. While earning my PhD, I had my practice, which served male survivors and perpetrators of child sexual abuse. Since arriving at BSU, I have taught evaluation and treatment of mental disorders, advanced research, statistics, field, as well as some practice courses to undergraduate students as well as graduate students. My scholarship focuses on mental health issues of the aging population, including the use of telehealth medicine and also predictors of successful aging. During my off hours, I'm an avid cyclist, often biking 100 miles at a time. I also enjoy bird watching in my kayak as I meander the rivers of Idaho. As often as I can, I visit my son and twin children who live back east, and I look forward to getting to know you. Let's review the Blackboard format. To assist your navigation of the course components, we'll review all that's on the web page. Once you enter the web page, you'll find the course components on the left-hand side. Announcements is the first component. Here I'll post updates about the course. I might post updates telling you there's been a change in the syllabus. Hopefully that doesn't happen often. Be sure to check the announcements at least once a day so that you keep up to date with any changes. Could be a course or assignment date, due date. Next is the link for the syllabus, which provides the course objectives, an overview of the assignments, my expectations of you, the required books, and the course schedule. I encourage you to download the syllabus and review the entire document. It may be helpful to use a scheduler to plan your study time. The estimated time to complete course assignments is provided in the overview of each module and will help you to manage your time. We'll review the components of each module in subsequent slides. The next two components include social work team meetings and social work teams. In real life, you'll be working with other social workers to assess clients, form diagnostic impressions, and develop treatment plans. Therefore, I wanted to simulate something similar to the real world. Therefore, you'll be assigned or you will enlist yourself into a particular social work team. You'll work with those team members throughout the remainder of the semester in assessing fictitious cases and formulating diagnostic impressions and developing treatment plans. And I think that you'll enjoy this activity. We also have course resources, and course resources is a link to Albertson's library and multiple resources such as financial aid, tutoring, and more. I strongly recommend that you review all the resources that are available to you to support your success in the MSW program. Another component is Ask Your Professor. This is a discussion forum for you to ask questions or make comments about the course, about homework. If you do have a personal question about your grade or about your progress, please email me and not post it on the forum Ask Your Professor. The course is divided into 7 modules. During the first half of the first module, you will have an opportunity to become familiar with the course format. You will find an overview of the course, which will prepare you for the weeks to come. The titles of the 4 required textbooks are given. To promote your success in the course, I suggest that you purchase the stated editions. Additionally, it may behoove you to obtain hard copies of the textbooks and not ebooks, as the page numbers do not align. I strongly urge you to keep your textbooks after the course has been completed, as they are recent additions and they will be valuable resources for you for many years after you graduate. To enhance your learning, I have provided a list of articles as well as videos to watch. The videos are extremely helpful as they provide a real world view of clients with disorders that we will cover. To assist you in prioritizing your reading, I have provided a coding system that indicates which books, articles, and/or videos are required to read or are suggested readings. This method has alleviated students' stress in the past in knowing what to read. In the real world, social workers will meet in teams to discuss clients as they determine their biopsychosocial needs, as well as their diagnostic impressions and treatment plans. To better prepare you for your postgraduate experience, you will form social work teams and review fictitious cases. This team learning approach has proven to be very effective in skill building, as well as increasing students' confidence. Additionally, the social work team meetings allow the students to become more cohesive as a cohort. To prepare students for the LMSW licensing exam, 1 quiz is given per module and is based on the readings from the DSM-5 and Wu and Keating textbook. Remember, anxiety is a normal emotion to feel when confronted with new material and information, yet it's an indicator of growth. Please do not hesitate to contact me in the beginning of the course if you have a concern or a question. Don't wait until you're really confused or you're not sure what's going on. Please seek my advice and counsel early on. I'm readily available and present. Also, check your syllabus and supporting materials before contacting me, as the answer to your question may be readily available to you, whereas it might take me hours or a day to get back to you. Lastly, the course learning objectives are stated. Please read the objectives several times, as they will give you an understanding of the benchmarks that you should achieve at the end of the course, and that will assist you as you complete the assignments. Each module is formatted the same to better assist you in planning your busy schedule. Each module provides you with an introduction or overview of the module's topic. The objectives are stated to provide you with the benchmarks of what you should know after completing the module. Additionally, each module provides a link to the professor's discussion board or forum. Please, again, if you have a question about the course, about the material, please use this. If you have a specific question about your progression or your grade, please email. Also, I look at the form, Ask Your Professor form, daily during the work week, Monday through Friday. However, I do not look at them during the weekends. So if you do have a question and you send it to me after 5 o'clock on Friday, you can expect a response on Monday. Now, there's three due dates that you should be aware of, and that's Tuesday, Thursday, and Saturday. And these are the same for each module. And you'll see under the due dates that social work team meetings, overview and process is given, and uh, the case review is due along with readings and videos. Thursdays, reading and videos, and then Saturday are readings. Now, as your professor, I consider certain ways of fostering your learning. And if we think about the definition of an instructor, a professor, or facilitator of learning, we think about someone who helps bring about an outcome. And my outcome, I believe, is for you to learn the DSM-5, how to use it in a responsible way, how to formulate diagnostic impressions, how to do assessments, as well as formulate treatment plans. And how can I do that? Well, I can be socially present. I can respond to your questions. I can be readily available if you have personal questions to ask. I also will look and be present during the social work team meetings, though I might not take an active role. I'll check in and see how things are going. Also, I've provided different modalities for you to learn videos, readings, group work. So hopefully this will facilitate your learning. Provide consultation again. Anytime that you have a question, please reach out. And I really enjoy meeting my students face to face online. So if you have a question or just feel the need to discuss an issue, then please feel free to reach out to me. Certainly want to provide an open, engaging environment, and I think the social work team meetings will do that, as well as providing clear instructions. The instructions have been reviewed, and I believe that they're very clear and will give you step by step guidelines. Provide feedback. I give copious feedback to my students, and I think it helps them in improving their performance in subsequent assignments. But I also realize that in order to be motivated, you need positive feedback, so expect that too. Also, I enjoy students coming with a different lens, and that's what is really nice about social work is that we can see things differently and respect how we look at things, how we might interpret our environment, and we can learn from that. So, how can you foster your learning? Well, you can commit to learn. You can read and understand the syllabus. If you have a question about that, let me know. Engage in discussions to share your experience and knowledge. You'll have an opportunity to do that with the social work team meetings. Be prepared, complete your readings and assignments on time, and support your fellow social work team members. Ask questions. There's always opportunities to ask questions, and don't be afraid. Don't be afraid to ask them. Recognize diversity among your peers. You come from all over the nation, and we have different ways of doing things throughout. So appreciate our differences and embrace also the responsibility to reflect upon your learning and your interaction with your classmates. Make sure that you follow the rules and etiquette. It's often difficult to communicate via text, and we might not interpret our text or someone texts the way that they meant it to be written. So please be careful about communicating. Well, I hope this video has been helpful in providing you some instruction as to the course itself, Evaluation Treatment of Mental Disorders. It's a very exciting course, and I look forward to seeing you and talking to you more.